Canadians are being asked to stay home this Remembrance Day because of the pandemic restrictions. We invite you to watch the ceremony live from the Canadian Warplane Heritage Museum at CHCH, on CHCH, starting at 10:30. This is a live shot right now as our crew prepares for that broadcast. And the broadcast is being sponsored by Nainesh Kotak of Kotak Law, who is very passionate about supporting our veterans. And we thank you again for helping us out with this broadcast. So there are many restrictions from staying at home, not just with veterans, but with lots of seniors as well. And you're particularly concerned about that this year.
Absolutely. You know, the pandemic has taken a tremendous toll, I think, on Canadians at large, but also those who are from vulnerable communities, such as the elderly, and which obviously includes many veterans, and also those who suffer from pre-existing mental illness, such as depression or anxiety. You know, with respect to our veterans, many legions are actually permanently closed because of the pandemic and lack of support. Many veterans are waiting for their benefits, and also waiting, unfortunately, for physiotherapy and for psychological treatment. And dozens of veterans have in fact lost their lives in long-term care homes due to COVID. With respect to the general population, or those who suffer from mental illness, I should say, if you look at our frontline workers, and I'm not talking just about our police, the ambulance or fire, but those who work in grocery stores and liquor stores, I mean, they're not trained to deal with the type of stresses of the risk of the pandemic and passing COVID on to their loved ones. So we're seeing an increase in anxiety and depression among that subset of population. And furthermore, you know, the Canadian Mental Health Association, they did a survey back in June, and they found that out of the people they interviewed, 2.5% had thought about suicide. Mm-hmm. And over the past few months, that in fact has risen to 6%. And I think the Canadian Mental Health Association does such wonderful work, helping those who are vulnerable and actually saving lives. And you know, this year, normally what myself and my office do is we give a nice donation to the Wounded Warriors Canada, and we celebrate our veterans at a professional hockey game. And obviously, due to restrictions of the pandemic, this was not possible. But what we've chosen to do instead to help the vulnerable is to provide a donation to the Canadian Mental Health Association in recognition of the good work that they in fact do.
Right, because sometimes we're being told, you know, people think that, well, maybe I'm not feeling well, but I'm not going to go for help because hospitals are closed or doctors' offices, there's so many limitations, right? So it kind of prevents you, if you realize that you need help, from getting that help.
Yeah, you're absolutely right. You know, first of all, there still is a stigma when it comes to mental health. Mm-hmm. So people are less likely to complain about those symptoms than they are the physical ones. And you're absolutely correct. And even if they want help, many appointments there's always a backlog in getting a psychiatrist, first of all. But it seems that now, you know, with the virtual appointments, and that's the best, unfortunately, that can be done unless someone directly goes to a hospital in a crisis situation. So, you know, with the virtual appointments, it's not the same, obviously. The physician or the therapist doesn't have that direct contact in terms of seeing more readily the body language and having that personal touch to help people. But you know, people are obviously trying hard. Our healthcare workers are really working very hard and need to be obviously commended for this excellent work that they're doing in the unfortunate circumstances we're in.
Right. Nainesh, thank you very much again for helping to sponsor our special broadcast later this morning as well. Always nice to talk to you.
Thank you. Likewise. Take care.